Chronic sore throat. What is chronic sore throat and how do we manage it? Chronic sore throat in medical terminology would also be known as pharyngitis. Chronic pharyngitis or chronic sore throat is usually a lifestyle disease, and it is generally related to what we have to eat or drink. What are the causes of pharyngitis, chronic pharyngitis, or a chronic sore throat? First and foremost is your allergy or allergic tendencies. If you have a throat that is allergic to certain food substances, then you are prone to developing chronic sore throat, and you should be more careful than others. I understand that people around you are all having drinks with ice or eating spicy food, but as soon as you touch something like that, your throat goes sore or raw. But that is the nature of things. It is possible you have a throat that has an allergic predisposition, so you have to be more careful than the others regarding all that you drink and eat. What are the common culprits that cause chronic sore throat? Most of these things we are aware of: having very spicy food, having iced drinks, having food that is fried, having outside food, particularly restaurant or street side food, eating chutneys, achar, having things like papad because they irritate the throat, they are dry and sharp. These are the common culprits which cause chronic sore throat. And of course, we must mention the effect of smoking. I get many patients who are smokers, and they always act surprised when I tell them that your smoking is causing the sore throat. It is obvious. All that noxious smoke that you're taking in, the first point of entry, the first point of contact is the throat, and there is a condition called smoker's throat where overall we find the oropharynx, the posterior pharyngeal wall are red and granular, and that is the appearance of a smoker's throat. So obviously if you're a smoker and if you have a sore throat, it is mandatory for you to stop smoking. No doctor will ever recommend that you continue with your smoking habit. Surprisingly, acidity and reflux are also causes of sore throat, and so is sinusitis, nasal allergies causing postnasal drip. So as we can see, the throat is in the middle of what can happen from the nose, which is the postnasal drip, is above what can happen from the stomach, particularly acid reflux, and especially when we go down to sleep at night, the acid comes up into the throat because the effect of gravity is lost and causes dryness and choking sensation, which are also symptoms of chronic sore throat. So the throat not only suffers because of throat problems, but it also is a secondary sufferer because of nasal issues as well as gastric issues, including acidity and reflux. The symptoms of chronic sore throat are usually a feeling of kitch or irritation in the throat, a constant desire to clear the throat, sometimes a chronic cough, burning sensation, choking sensation, sometimes pain, and if it becomes secondarily infected, there may be fever as well. What is our remedy for chronic pharyngitis or chronic sore throat? The remedies are, number one and most importantly is avoidance. Number two is to take a simple anti-allergic tablet which will take care of your symptoms related to allergy. Number three, if your sore throat is being caused by acidity or reflux, please take a simple antacid from over the counter, or please visit your ENT specialist who will examine and tell you what is the appropriate therapy. We can also use gargles. I'm a firm believer in the value of gargling for the throat. You may gargle with simple home remedies like saline gargles, or you can use povidone iodine, or you can use Disprin, or other agents that are available to you which you are comfortable with and which you think make your throat comfortable. But saline gargles or warm saline gargles have stood the test of time. They are safe and they are effective for chronic sore throat. Half a glass of warm water with half a teaspoon of salt, gargle 2 to 3 times a day, and you should be fine. Sometimes a chronic sore throat may be hiding some lesion inside which needs to be checked, particularly if you are a smoker and you consume alcohol regularly, or if there is a family history of upper aerodigestive tract or throat cancers. If you have a chronic sore throat which is not settling down, especially if there is pain in one localized area, or if discharge from the mouth or oral is bloodstained, you must immediately consult your ENT specialist who would like to examine you to see if there is any other sinister lesion inside. I repeat, sore throat, chronic sore throat, pharyngitis is usually a lifestyle disease, and if we are careful about what we eat or drink, if we do simple household remedies like saline gargles, we should by and large be alright.